psychiatrists deal with, although GPs, like 25% of our work is mental health work anyway. And then you have the physical health. I'm not sure that we can sort of separate them because the mental health affects the physical health affects the mental health, and that also affects our own overall well being. But if we're narrowing down to physical health, that's also fine. So, a healthy mind can only be in a healthy body.
Hmm.
So, if you don't have a healthy mind or a healthy body, you can't really function, basically. So, if you're physically unwell,
Hmm.
you will struggle.
Hmm.
You will struggle. Your whole well-being will struggle. Let's just give an example. If you have a headache,
Hmm.
how much function can you really have with a headache? You have a headache, you can't watch TV because the light will be too bright. All you want to do when you have a headache is to lie down and sleep, drink some water, find some paracetamol or whatever you want to get it. So something as what people call a simple headache can, mess you up. Imagine if you had other serious or more serious problems. So, if you are not physically
Hmm.
well, your overall well being will be affected. And it just depends in the degree of function that you have as a person. Some people are highly functioning human beings that, they can push and push and push and push until, the very end before
Hmm.
they show, you see the signs that people can see the signs, but your body will always tell you signs of physical health problems,
Hmm.
whether you decide to ignore it
Hmm.
or not. So in summary, if you is anything wrong with your physical health, you can't function 100% as a human being.
Thank you so much for that, Dr. Zelda. So I would say that, when people even have headaches, so we should not take it for granted,
Yes.
especially when we are not 2 years old. Okay,
Yeah,
two
even
years,
even a 2 year
three
old.
is true.
Because there's only a thin line between what is a deadly headache and a simple headache,
Hmm.
but you can never know until you
Hmm.
see, a medical professional. So,
Hmm.
like, I'm not saying every single headache you need to rush to the hospital, but it's when it persists. So, a persistent headache that lasts for days on days on end,
But sometimes,
you should.
because we work, we may say, oh, maybe because of stress at work.
Even stress is a problem.
It's a problem.
Stress is a mental health problem that presents physically.
Hmm.
So if you have stress, you have headache. There's
Yeah.
still something called stress headache. Sometimes you won't sleep because
Hmm.
you're stressed. Sometimes you have palpitation because of stress. Sometimes you
Like
have
our
anxiety.
hearts
Yes, like your heart beating
beating.
fast. Sometimes you have
Hmm.
anxiety because of stress. So
So those are like alarms that God puts there.
yes,
So it's even God,
yeah,
and He expects that when we have those alarms, tries to signal to us or
yeah.
try to just beep, we should do something.
Absolutely. It's just like when you have a
Mm.
fire alarm in your house, like
Mm.
every house in the UK has fire alarms. The fire alarm doesn't just pick up
Mm.
fire. It speaks of steam.
Hmm.
If you're in the shower and
Hmm.
let's say you're in all those kind of self-contained or ensuite type of rooms, and then you open your toilet or your bathroom and you have a fire alarm in your room, if the steam from the bathroom comes into the room
Yeah.
and when you don't put on the air expeller, the fire alarm will be triggered. It's not because there's a fire,
Hmm.
but it's gotten a signal that there's something happening that can progress into a
So
fire. So
fire.
it picks it up. So it's just the way God has created the body
Hmm.
that if there's anything big happening, it starts with the small things. It's one
Hmm.
headache here
Hmm.
and one tiredness here, sleeplessness here,
Hmm.
tummy pain here. It's just simple things like you were saying you were
Yeah.
driving and you noticed something in
Yeah.
your vision and
Yeah.
you went to have a check. But some people
Yes.
ignore it, but you shouldn't be ignoring those bells,
Hmm.
especially when they're persisting.
Hmm.
That's the word, persisting, or they're
Hmm.
very, very severe.
Hmm.
So you don't ignore
Ignore.
those alarms, no matter how much of a strong person you are, or no matter how much faith
Hmm.
that you
Yeah.
had. God has put those things there for a reason, and the doctors
Hmm.
or the medical personnel are there, for a reason as well.
Hmm.
Yeah.
Thank you so much, Dr. Zelda. You said God has put those bells there. So it's just like, I always ask people, when was the last time? I said it previously, and I'm saying to the audience, when was the last time you even had your blood pressure checked?
Hmm.
Like, Yorubas will call it ifunpa, that thing they wrap around the ham,
Yeah.
and then
They pump.
they pump, and then it now blows up. When was the
Yeah.
last time you had that done? When
Yeah.
was the last time? When was the last time you had your fingers pricked? When was the last time you had your eyes checked? Oh, I don't use glasses. Yes. When
Mm.
was the last time you had that done? When was the last time you even called your GP to say, see, I have been in the UK. I've not had any bloods done, or I've
Mhm.
not had any checkup since I migrated. Please, can I have one? See, there are things you say. You're not lying, except if you are lying. But I'm saying, I will say the truth. See, this is it.
Mm.
Can you please, can I come in?
Mhm.
Even if they say no on the phone, I still tell people there's this
Yeah.
thing about face to face connection.
Yeah.
When I come to meet you, I say I need help. You won't tell me to get out. No,
Yeah.
no. And that's why sometimes I tell people, say, if I need help, even if I've not seen you for 20 years, I will call you for help.
Yeah.
So if you say I'm a beggar, so
It doesn't matter.
it doesn't
Yeah.
matter. So all we're just trying to say is that we should not be ashamed to seek for help.
Yeah.
And because we don't want anybody to die. See, I used to say that the time we migrated, some of us were in our 30s when we
Mhm.
migrated.
Yeah.
Some were in the late 30s, some were in their early 40s when they
Yeah.
migrated. So anything can happen.
Yeah.
And sometimes when they talk about the life expectancy back at home and here, as in
Yeah.
there's wide
Big
gap,
disparity. Yeah.
big disparity. And one of it is that health seeking behavior.
Yeah.
That bells, headache, oh, my eyes, something is happening. No,
Mm.
just leave it. God, please heal me. I remember seeing someone of recent and she was saying, oh, I have high blood pressure. It's not my portion in Jesus' name.
Amen.
Amen. I also believe
It's not your
it's
portion,
not
but
it's not
you
anybody,
have
but
to seek help.
seek help. Because if we don't seek help, Dr. Zelda, if somebody's blood pressure is even high, or they've never even checked, like the story you shared, what can happen? Can you please tell us what can
They
happen?
can die. That's the basic thing.
Okay,
You
so
will
that is
die.
even
So when
simple,
yeah,
right?
that's a straightforward thing. You will die, and the reason is this.
Hmm.
I'm not saying it to be a bad
Yeah,
news
yeah.
bringer, but the thing is that when this, sometimes they'll say what you don't know can't kill you.
It
It's not
kills.
true. It's that thing that you don't know that will kill you. We are seeing this happen a lot with very young,
Hmm.
like
Hmm.
youngish men, late
Hmm.
30s, early 40s, that
Hmm.
have just recently migrated,
Hmm.
slumming and dying, and then they'll tell you no previous medical history.
Hmm.
Case in point, I have a friend who migrated to Canada. He's 38 years old. He died last year, and he
Sorry about
died
that.
sitting in his living room watching TV. I
Jesus.
only realized or got to
Oh,
find out that he had high blood pressure, and we
sorry.
didn't
And is
really
it
know.
doctor?
He's not a doctor, but it's this sort of thing. He did go there. He has blood pressure problems. I don't know what the real story is, whether or not he was seeking help, but we always talked. He
Hmm.
never talked about going to the
Hmm.
hospital or anything like that. But it's those things.
Hmm.
He definitely must have died from a cardiac arrest because of how
God.
it happened. But what caused it? He has the history with hypertension. We don't know whether or not if he was taking his medication. We don't know whether or not since he
Whether
had
it was
just
controlled.
migrated, within a year,
Yes.
if he had gone to get help, like registered with a GP or all those things. So it's quite common. It happens. Like I was saying before,
Hmm.
we've been having younger people who are immigrants just
Hmm.
dying, either slumming or just
Yeah.
not waking
Yeah.
up.
Yeah.
And what is the reason? There's sometimes they tell you, oh, he has no medical history, never been sick a day in his
Hmm.
life. That does not
That does not mean.
really mean that you're safe.
Even if you are slim, even if you are size
Yes,
two,
no, nothing. It's
no.
knowing your numbers is the only thing that will save you. Yes, God will save all of us, but you have to know your numbers. And when I say knowing your numbers means you have to first of all know your blood pressure. First of all, your weight, your height,
Hmm.
and then that translates into your BMI. You have to know where you are in the scale of the BMI.
Hmm.
Although studies have shown that the BMI is not really 100% perfect for people of maybe African descent and whatnot. But the truth is this: it's not perfect.
Dr. Zad, I'm sorry to
Yeah,
interrupt you.
yeah,
I had a lecturer in my
yeah,
first year in the university. He's still very slim. He was very slim then.
yeah,
He had high cholesterol
yeah.
and he was off for like at some point. almost a year. He was
Mm.
unwell. He's very slim. So if you're size 8, it's good, it's great, but go for checkup.
Yeah, slim
So
doesn't
continue,
always mean
continue.
healthy or fat or big.
Yeah.
Doesn't always mean unhealthy.
Yeah.
So you need to know your numbers. So your weight, your height, your BMI, so you know what scale you are. You're underweight, normal weight, overweight, obese, and all the other things that go. And depending on where your
Hmm.
BMI falls, then you know that there are other things that can be associated with it or whatever risk factors you will be under. You should know your blood pressure.
Hmm.
Very important. At least once a year, you should have your blood pressure checked. That's if you're not hypertensive.
And Dr. Zana, I'm sorry
Yeah,
to interrupt you again. If, for instance, I'm a carer
yeah,
and I do all of this blood pressure thing for patients,
yeah.
can't I also buy mine and tell
Exactly.
someone at work to do it for me if I
Absolutely.
can't do it myself? But I
Absolutely.
should have one.
Yes,
That money sometimes that we send back home,
you can use
20
it.
pounds, we can
Buy your blood
buy
pressure.
or
Yeah.
online blood pressure machine,
Yeah. Even go to Boots and all of
boots,
you can see £20
and
you
look
get.
after
Yeah.
ourselves. Because the truth is, we're
Absolutely.
talking about what can happen if anything goes wrong with us. Nobody would look after the children we have
Yeah.
here.
Yeah.
Nobody would look after us here. Imagine, I used to tell a friend, I say, see, please, I'm begging you. This UK is a fake place. No, what I would explain, I say, please, check, look after yourself, check your blood pressure. We don't want you to have stroke. And I say it
Mm.
to that person directly because, see, it's lonely. See,
Yeah.
sometimes you feel bad. Okay, our friends have babies. Have you stayed there in a day to help them look after baby? No, because everyone is
Busy.
busy. So imagine if someone now has stroke. I, I ma- being an house officer in Nigeria, I manage many people with stroke. When they come in with emergency, sometimes like 170.
Yeah.
And they come in, in that hypertensive emergency, and you're like, and then some people will still be working 220. You say
Mm.
no. I remember somebody still telling me yesterday, I needed help. So the person wanted to help me fix something. I was like, oh, he's not even in Nigeria. So it was like saying that, oh, it's 220. And I'm like, hey. Remember that I started thinking, I don't want you
Yeah.
to slum in my house, so please, and everything, because anything can happen.
Yeah.
So, and it's I don't mean that it's a fake place, but nobody, as in like, because if people have stroke, for some people it affects people differently. We won't go
Yeah.
into all those
Yeah.
paralysis and all those things. We
Yeah.
won't go in, we won't go into that. But some people, their speech will be affected. They won't be able
Yeah.
to talk. So that means, how do they function at work?
Yeah.
It may take time to rehabilitate them,
Yeah.
speech therapists and
Yeah.
all that. If they can't really work, if it affects, that part of their, their limbs, and they
Mm.
cannot, really walk,
Yeah.
or they are bed bound,
Yeah.
they will start using wheelchairs. I'm not
Yeah.
saying that people will use wheelchairs, but they now have to get
Yeah.
used to, and then start having to rehabilitate themselves to be
Mm.
able to do other things that,
Yeah.
with the wheelchair.
Absolutely.
But it's a journey. Sometimes I tell people, if anything happens now, yes, we know God would heal us. Yes. And even when God heals you, you know that something happened in your body and it is still a journey.
Yeah.
So please carry on, Dr.
Okay.
Zelda.
So you need to know your numbers with your blood pressure. You need to know what's normal and what's not. And you need to know what the warning signs will be if you get a number. Like she was saying, it's very cheap, £20. You can get yourself a blood pressure monitor and you can use it to see, what your numbers are. And if there's any warning signs, some of these machines come with the digital ones that it tells you if it's danger in the red zone and the amber
Mm,
zone and the green
mm.
zone, you can get those type of digital monitors, or even go into a chemist and ask them to take your blood pressure. They will do it. I think there are even machines in chemists like Boots where you can put I think 1p or something, and
Oh,
you can stand on the thing. It has the scale and has the you
wow.
put your hand in, it takes your blood pressure and it prints out
Wow, that's
a
good.
a slip for you to know.
Hmm.
So the reason you should know these numbers is you need to know what your baseline is.
Hmm.
Are you healthy or not? Do you need to now have intervention or not?
Hmm.
And then you also need to know
Hmm.
your numbers when it comes to your blood tests.
Hmm.
Starting first, especially because we are Nigerians and we are West Africans, sickle cell is highest in West Africa. I think mostly Nigeria, I'm not too sure, but I know it's in West Africa.
Hmm.
You need to know your genotype.
Hmm.
I have seen many Nigerian women who come to the UK and then they're pregnant, and then the first time in their life that
Yeah.
they know that they have sickle
Sickle
cell
cell
trait
traits.
is when you do the antenatal bloods, because they're very thorough. When you go for your, booking blood, that's
Yeah.
called, they do everything. They do your, your sickle. They check, especially if you're African or Indian descent. They will check, and then people. I think it was 2 weeks ago or so, 3 weeks ago. I remember seeing, a name that was Nigeria that was familiar, and then I saw that, they were screening and it was sickle cell trait, and this person didn't know that, they had sickle cell trait, and it's very, very important. I'm sure a lot of people know about SS, sickle cell itself, or the AS or the SC, how it works when two people who have the traits marry, and what sort of children they'll have, and things like that. So that's very important.
Or Dr. Wilda, or maybe you can talk about even people having recurrent miscarriages.
Yes, yes. So there's a lot of things that will happen with the genotype, really, and the blood group, and then the genotype as well. Blood group is important because you need to know if you're on the negative or you're positive, and things about, the negative. You can never tell if you're negative and your husband is positive. You can have recurrent miscarriages. But people just say, child loss in first trimester all the time, and that is one of the risk factors to that. So it's important for you to know what your numbers are, and then you also need to know your blood count, and maybe not 100%, but you need to know whether or not you're anemic, and if you need to be on supplements or not. That's also important, a number to know. And then not last or not least is the blood sugar one, the thing that's called the HbA1c. Is basically a blood test that's done to monitor your blood sugar in the last 3 months. Basically, they use your red blood cells, and because the red blood cells have a last lifespan of 3 months. So when they take it, it's able to calculate your blood sugar in the last 3 months of your life, basically. So the numbers are good. I like what we were saying earlier. 42 and below is great. 42 to 48 is like you're intermediate. You're at risk of diabetes. You need to lifestyle, diet, very important at that time. You need to be closely monitored, eye screening. There's lots of things that get done when you present to the GP, and then if you have over 48, you get a particular type of treatment as well for it. And I mean, there's different numbers you should know, but I think that these ones are the basic ones, and they're most important. I think the last one I should mention, and the reason I'm mentioning it is your kidney function. And the reason I'm mentioning it is because chronic kidney disease or end stage renal disease is becoming more and more and more common in Nigeria. Every other day, people are raising GoFundMe accounts and saying they need a kidney transplant, or for dialysis, they need to go to India. Or I think there's like hospitals in Abuja now that you can even do transplants there. People are getting, and there's lots of things that will cause you to have kidney problems. A lot of the first thing that causes it, apart from even having hypertension that you don't know you have, hypertension affects the kidneys. There's some of us who like to take over-the-counter medication, especially things like ibuprofen. You have a headache, you swallow ibuprofen. Body pain, because a lot of people are carers, so you have gone, you have helped people, you have lifted people the whole day, and you're tired, you're in pain. You take ibuprofen, you go and buy, you buy, and that is chipping at your kidneys. And because you're not checking, you don't know what your numbers are. You wake up one day, swollen face, swollen legs, swollen tummy, and you feel like you're not peeing as much as you should. And that's when you go to the hospital and find out that you're stage 3, stage 4, stage 5, and probably need dialysis, or maybe you need a kidney transplant or something like that at that point. So those are numbers that you should know. And there's other things. There's so many things. There's screening tests. There's screening tests that happen in the UK, because it's a society that is quite.
Dr. Zelda, let me interrupt you.
Okay.
I remember someone said to me, not a Nigerian, so she said the cervical smear, she will never have it. And I'm like, please. He said, no, NHS, this one, not in Nigeria. She said, no, she's not going to have it. And I'm thinking, so I knew you said it. And I remember asking somebody again, maybe a Nigerian, she said, no. No, they called me the letter. I'm like, please, say, As in, you are actually saying very important things. Even men,
Yeah.
well, all of this thing is actually about men and
And
women,
women, yeah,
but we are
it's
just
not.
we are just talking about cervical smear that is for women.
Yeah,
Except for people who have done surgeries to undergo changes and all that.
yeah.
So we need these things are serious, and it's like it's free.
It's
It's
true.
free. I remember, okay, you talked about knowing your numbers. There was a time my platelet count was low according to them. Yes.
Yes.
And then when they asked me, I said, no, according to the research done in Nigeria, our platelet count is from this to this, but
Yes.
their own is different. So I said, don't worry.
Yeah.
Even though it was low, I knew, but it was still it was still within the normal in
Yeah.
Nigeria. So
Yeah.
I knew because I remembered I was taught in class, say this, and then they will now say, oh, it's low. And then I know there are times I have nosebleeds and
Yeah.
everything, but then and I was actually pregnant then. So I said, oh, don't worry, I know this is it. My second pregnancy again, I said, no, that's it for me. And so knowing the number so that if
Yeah.
anything changes, you know that, oh, before
Exactly.
my HbA1c was 30 something, and
Mm-hmm.
then if it now changes to 42, you
You
know
know.
that one is in trouble,
Yes.
and then 42, 55,
Yes.
there's trouble.
Absolutely. And that's
Yeah,
why, yeah, knowing your numbers is good. Like, if you imagine, if for instance you didn't know, okay, so when you talk about the
yeah,
platelet count and saying
yeah,
people in Nigeria, there's something that they call ethnic blood
yes,
blood tests.
yeah,
There's some that no ethnic numbers. Let me put it like that. It's not a thing, but I'm just going to describe it like that. So it's been found that
hmm,
people from certain ethnic group,
yeah.
when it comes to their complete blood count, in some
Mm,
things like their neutrophils or their white blood cells or their platelets
mm,
can be lower than those in the UK.
yeah,
And but if you're
hmm.
somebody who never knew your numbers and you don't know anything about this, you would see that maybe one day you're unwell and you see that and everybody starts to panic and then you have to do multiple tests and tests and tests
And that's why
and
we
you
don't
know
use some mental health medications in Nigeria.
yeah,
There's a particular one because they know people from African descent, because you talked about white blood cell count. Maybe we should not really go into all this
yeah,
medicine for some people. I'm so sorry. So, because it can go low and they will now say it's amber.
yes,
So, they will now say red flag.
yes,
So, knowing the number
it's very
is very important.
important, yes.
Everything. So, give us a gift today before we go on. Go and call your GP, call your doctor to say, hello, my name is XYZ. Can I have, oh, why? I've never had anyone done. Oh, I last had one done last year and I have a family history.
Sure, yeah,
See, you said what you don't know even kills people.
yeah,
And I remember asking, so you said, oh, since 3 years ago, I said, ha, and she's over 40. Say, please, don't do this, don't do
mm,
this, please. Even if you are 30 something, it's not about age.
yeah, it's not
Eh,
about
I was in
age
my 30s when I went to check, and I
and
was always checking. So
yeah,
because I was always checking, because I knew my grandmother had diabetes,
yeah,
this or that,
yeah.
so I knew. So please,
And another thing, you said you don't call your GP. Before they call the GP, they need
yes.
to have one. So I would say if you're an immigrant, you've just come to the UK or you've been in the UK for years and you don't have a GP, please,
Hmm.
in every single area, there's always one GP that's within 10 to 15 minutes from you.
Hmm.
You should find them. You can use the Google search and say GP near
Near
me.
me. Hmm.
Find them, go there and say, I would like to register. They will give you a form. You fill it out. I think sometimes they
Hmm.
might ask you for a passport or not. They didn't
Hmm.
ask me anyway. But you fill it out, and almost immediately they register you, and then they'll give you an appointment for a health check. So every new patient that comes into a practice,
Is
you
meant
get
to
a health check.
and go for it.
So you don't even need to even be the one to call them. So once you go and register, they will call you in for a health
Hmm.
check, and that health check will include blood tests, your blood pressure, your BMI, your weight, all of those things. You will have that numbers. The reason they do it is because they need to have a baseline for you,
Hmm.
so that in the future, if you have any problems or if things change, they can go back to the baseline and say, okay, last 2 years the blood pressure was this. Now the blood pressure has gone up. We need to do something about it. It just helps you get
Hmm.
help quicker.
Thank you, Dr. Zelda. As you were just talking, I just remembered. For instance, if you have family history of cancer,
Yes,
we
very
trust God for
important.
healing. I remember the particular friend came into the UK, because and she knew, oh, family history of cancer. She went for every test possible.
Yeah.
So even as women, even if you know, don't just okay, when you hear that someone died, whether at home, try to
Find out
know,
why.
ask why did this person die, what happened,
Yeah.
what happened. Even signs, as like for women, touching, I don't know, this is YouTube, how do we say, touching that part, are there lumps on the
Yeah.
chest
For a breast
area? Breast
examination. Yeah.
examination, yeah, are there lumps? Check.
Yeah.
If you notice anyone, if you are not sure, please call your GP.
Yeah.
Anything, you're not, even if you're a doctor, you're not your own doctor, and it's
Yeah.
actually very wrong for you to
Yeah.
prescribe
For yourself.
medication for
Yeah.
yourself. So
Yeah.
there are people, we are all accountable to one
Yes.
another. So you can't
Yes.
treat yourself, but don't ignore the
Signs.
signs. They
And
are
yeah.
bells and
And then
alarms.
for you to not ignore signs, you
Hmm.
need to know them. Well, this is what I always tell my patients, because it's difficult for anybody to exhaust all the signs that you need to look out for. I always say,
Hmm.
you know your body better than I would ever know it.
Yes.
So if you notice anything that is different,
Hmm.
that's the sign. So the different can be anything. It's not limited to
Chest
anything.
pain. I've never had
Any
chest pain
single, yeah,
before, and you
exactly.
now have chest pain,
You should
and they are
not.
telling you no is they will say sometimes musculoskeletal.
Yeah.
You know yourself. Oh. See, I will say something about this chest pain. There was a time we heard about a doctor who died. This person actually even went to the hospital,
Mm,
and they said nothing. If you continue to have chest pain, see, call everybody, scatter ground. You know the way they say.
yeah.
One day somebody said to me, looked at me and said, "Oh, I know Nigerians. They are very, they don't take rubbish." So she was now trying to side me up that, but you are quiet.
Mm,
And I was actually asking about a colleague. That colleague does not take rubbish from anybody. They know her. Once she steps into the room, I won't call her name. They know she's coming. Here comes the lioness. So that lioness spirit in you, shake ground.
no.
Call everybody that you need. I am having chest pain, and they say, "Oh no, don't worry." No, they have to do everything, and make sure if you have friends who are doctors, call them,
Mm,
eh? Because we don't want to lose you. We love you. We don't want your families to lose you.
mm,
It's lonely here.
yeah, it can be lonely if
Can be
you're without
lonely.
family. It can be lonely. So coming back to what you said about breast examination and
Yeah,
things, those are screening tests.
yeah,
Those are not really your numbers. Those are your
yeah,
screening
yeah.
tests. So the screening test in this country, you have
Hmm.
screening tests based on the age.
Yeah,
There's like
yeah,
how old you are, and different screen tests start from certain age and all of that.
yeah.
Like things like the cervical cancer screening starts from the age of
Yes.
25, and you have it every 3 years until you get to a certain age, and it
Certain age.
becomes every five
5
years. So I
years.
think it's changed recently now
Yeah, I think
to once you have a negative test, you will be called back in 5 years,
five.
something like that. Anyway, so
Hmm.
for the cervical screening, it's quite important because um, it
Hmm.
is it's a screening test to help catch cervical cancer, basically. And cervical cancer is
Hmm.
just something that happens because of a virus, and that virus is a virus that people can get from, and mostly from some kind of
So,
sexual orientation or sexual behaviors. Well, it's quite easy for
hmm.
people to get it. So basically,
Hmm.
what the screening test does is to check your cervix to see if you have that virus
Virus.
that can predispose you to having the cancer, or
Cancer.
if you have the virus and if it's already starting to change the cells in your cervix, you get treated.
Yeah.
So early diagnosis will
Early
get you early
treatment.
treatment and will reduce the complications
And one can live
that might,
long.
yeah, and then you can live a longer,
Yeah.
happier life. But yes, like you were saying, I have seen a lot of, because it's not something that's quite common to do in Nigeria. I've seen a lot of us coming, and then we get the letters, because once you come in, you're registered with a GP. You will get letters to say,
Yeah.
it's time for you to go for this screening or that screening or the
Yeah.
whatever screening. Some people ignore it, a lot of people ignore it.
Yeah.
And this is again coming to what they're used to. Community, if everybody's saying, I beg, I'm not going, then nobody's going. But if
Hmm.
the community is saying, I know we don't do
Let's
this
go.
from where we are, but I have done it, she has
Yeah.
done it. we should do it. And I
Yes,
think that
no.
this, sort of interaction is going to help that. If you get the letter, make the appointment and go and have it. And I remember I used to have a neighbor who was a Nigerian neighbor. She slept quite young
Hmm.
and she's still a virgin. And she got the letter. She asked me, "Oh, I got the letter." And I'm like, "Okay, yeah, you should go." And then she went to the GP and was turned back because she was a virgin. And the reason is this: because of how the
Okay.
test is done, if you're a virgin, it might be so difficult or so painful
Okay.
for them to use the speculum. Some people will say if you are a virgin, meaning that you're not having any type of sexual intercourse, like nothing. It's not that you're saying you're a virgin and then you're having oral sex. Oral sex is one of the things that cause,
Of course.
can predispose you to the virus. But if you're like a virgin proper, a lot of people don't go because there is no
Hmm.
entry for the speculum to go.
That's
Some,
the
yeah,
thing,
the
the tool
speculum is like the tool that's
they
used
put.
to, put in the cervix to do the test. But for some places, they have like the really small sizes that, like, they're
Mm.
I think they call them the pediatric speculum, that they
Mm.
can use, to do it. Some, I mean, it's different for
Mm.
people, but I
Hmm.
would say if you get the letter, book the test and go to your GP. Let whoever you see be the one to tell you that we can't do it for you. Or not. You shouldn't be the one to make that decision. And sometimes there are people who can't be done by the GP. They can go and do it in theaters. Especially on people who have like very low pain threshold or people who have vaginismus. There's different things, and those people go to get the screening test
Yeah.
done under anesthesia
Mm.
to
Mm.
help them. So, don't ignore those things. And
And,
then,
and and also, don't, sorry to cut you short, Dr. Zelda, even for pregnant women
yeah,
who have just given birth and they're still not sure about their bodies.
yeah,
I remembered, okay, I saw someone at work of recent. Women, I'm like, she have, does she have sickle cell? I was just looking at her and I asked her a question, not even sickle cell.
mm,
Do you have you just given birth? I don't even know. Do you have a child? I just gave birth. I said, no wonder. I said, you are pale. You are pale. Like,
mm,
because I was afraid. And she said she's still breastfeeding. But because bills, she had
mm,
to come to work. And I looked at her because even me seeing her, I said, oh God, this is
mm,
one of my sisters. In my mind, I'm like, I can just see this one is pale. I looked at her eyes. I looked as in we were just talking. I was
yeah.
not diagnosing.
I mean,
She's
it's common
walking,
for
and I
doctors
was
to
just
have.
looking. And I'm like, no. And I looked at. So why me now? He said you are pale. You need. Have you gone? He said no. She's still having tummy pain. I said please call. I said I used to tell people even when you go to work and you say no time. I say, please create time for your life.
Yeah, if
If
you're
anything
dying,
happens, they will replace one. So this is
mm,
what you do. Even if you can just take permission, please. And I think sometimes we're afraid to take
yeah,
permission.
fear is
It's
a big
like
thing.
we think we're not slaves. So we are kings here. We are kings with the help of God. We are not slaves. So nobody should treat us like slaves and we should not treat ourselves. So you can take permission and say, please, I
Mm,
need to call my GP now. I need help.
yeah,
And then nobody will tell you not to go do that call.
yeah,
Nobody will tell you not to make that phone call. So call. And so there's another lady too. She, like I've been telling her, you need to look after yourself. You need to look after yourself. Okay, so I said, call them. And she said, okay, she's going to call. And she called and they've given her appointment. So I said, just
yeah,
like Dr. Zeta was saying at the beginning, stand on his skill. Check. If you think you need help, well, yeah, they can refer you to weight
yeah,
management groups.
yeah.
And I would not talk about, but there are other things people do these days.
There are many
And
things
to
that
cut
are
down the
helpful.
risk of deaths or of not living long. And I believe, do you know when I was speaking with that lady about that one that just gave birth and everything that came to work, I wanted to cry. Because how can I just see someone for the first time and I'm like, this person is pale. There's something going on. Even her face looking tired, but she had to show up. So please,
And
hmm,
I think the thing, that statement you made that she had to
to
show
show
up,
up.
there's nothing like that. You don't have
Thank you.
to. You don't have to. And this is a society where if you're at work, they want you to be there and give your 100%. And if there's at any point you feel like you are
Hmm,
not able to give your 100% because you're unwell,
hmm,
is the advice that you should call in sick and go and find help. But I think
Don't call in sick and stay at home.
yes, call in sick and go and find help. And I think that boils down to what I was saying from the start. The help seeking behavior is really poor.
Hmm.
We always have to
Hmm.
fake it till we make
Make
it.
it.
And then there's also the thing of
Hmm.
being Nigerians are strong, you want to be seen as strong. And I don't know, I think that
Jesus is
the sort
strong.
of strong that they talk about is a very toxic one.
Hmm.
Strong means
Abusive.
that you're suffering in
Silence.
silence,
Hmm.
and that's not it's not healthy to be strong
It's
in
not.
that way. So if you're unwell, it's
Hmm.
okay to call in sick and say,
Yeah.
I don't feel well today. I will
Yeah.
not be able to work. I need to go to the
Yeah.
hospital.
Yeah.
And it's as simple as that. No one is going to be upset at you, because I think that's
No,
when I
it's
talk
okay for
about
them to be
fear.
upset.
No, that's what I
But
talk about fear
yeah.
again. Like, you have the fear or the perception of what will people think or what will people say if I don't show up to work, or I'm supposed to be on call today but I'm sick. I'm going to go into work because I'm strong and I have to show up. You don't really have to show up. If you're not well, you're not well.
Yeah.
You can't show up. And that for that lady that you talked about, being pale and all of that, and just having just had a child, and then you saw her pale and she thinks that she doesn't have to come to work. She doesn't. And the truth is that not many people will care and look at you and
If
say, oh,
anything
at work that you're
happens.
not well. As far as you're there, they believe that you're okay and you
Yeah.
can work. So if you're not well, seek help. You don't have to show up. You don't have to be strong.
Let me give a personal example. A few weeks ago, I think May ending, just few weeks ago, not like any long years or something. I woke up around 4 something and I was anxious, like felt bad. I said, Jesus, really? One of those things was that, or well, what happened that day was a particular day. I was supposed to go to a particular place, sitting with someone, and I knew I was not ready for it. So 4:20 something, I sent an email early in the morning to say, I have 2 appointments. One was not a prior appointment, but I had to because I felt I am unwell.
Yes.
And I had to quickly, that morning, I walked straight to the GP, said, I want to have an appointment because I was like, hey, I'm anxious, God. And then the second appointment, I had to go look for, this staff well-being.
Yes.
So like a counseling
Yeah.
therapist or like a session.
Yeah.
And I did not get to walk to like around 11 or to 12. I had to sort out. I said in the letter, I said, I have 2 appointments. Yeah. And actually, eventually I had 3. One, I went to the GP. 2, I went to do blood test. Third one, staff well-being.
Yeah.
And we've decided that it's good that we be open. There's nothing to hide. Yeah, I believe God. As a matter of fact, I remember there was a particular day, it's like my heart just popped. And I'm like, God, I remembered when I was in medical school, a particular children were doing memory verses. A particular child recited Psalm 56, I think verse 4. He said, when I am afraid, I will trust in you, God. And I'm like, God, where is this fear coming from? I am a happy person. Where is this? And immediately I spoke the word, God help me. But you see, that day that I woke up, it was not just a one-time thing. Things had piled up. And I woke up and I'm like, God, for something. And fear gripped my heart. I said, no. Yes, I prayed. I gave thanks to God. As a matter of fact, when I got back to work, when I showed up, I was happy. I sorted out my life, myself.
Exactly. So you have to take action. It's important to always take action. Stop hiding. Speak out. Talk to someone. I mean, you don't have to talk to me, but you should find your community, and that's what that WhatsApp group that I created it was for, or is for. You should find 1 or 2 or 3 people that you can talk to and say, you know what, this is what I'm experiencing, and I need help. And I'm always happy when I see Nigerians in my clinic, and I've seen just a few, to be honest. And recently I saw one, and a lady, lovely lady, and when she saw me, there's this I don't know her, but that thing, someone who looks like you on the other side of the table, you believe that they can communicate well. And then when
Yes.
I said her name, because sometimes you see a black person, you don't
Mm.
always think that they're Nigerian. So when I and then my name doesn't really sound that much Nigerian. So then when I called her name and I pronounced it quite well, and she's like, "Oh, are you Nigerian?" I'm like, "Yes, I am Nigerian." You could see
Mm.
how settled she was. She first came
Yes.
in, a bit anxious, and then you could see her settled. And then I try my best to take time to say, you know what, this is what you're entitled to. You should ask questions. Because when I finished talking and I said, I asked that question, I'm like, you don't have any question to ask me. She said, no. I'm like, why?
Why?
You should have. I mean, you
Ask.
came here with a problem. You
Hmm.
should be able to open up and ask questions. They're not going to beat you.
Yeah, and if you cannot ask a question, that means you're in an abusive
Exactly.
place.
You should be able to ask questions when you see your GP and say, okay, even if they say, okay,
Anybody.
okay, we're going to do this test.
Or even at work.
You could
Ask
ask,
why.
yeah,
Why?
you could ask, okay, so why am I doing this test, or what's this test for? And
Hmm.
people will be more than happy. I know GPs are very busy, we have very limited time to see you, but if you ask a question, no one is going to say shut
Hmm.
up and go.
Yeah.
They will explain, explain things. And then when we did all the blood tests, we did the scan, I requested a scan, and she was quite surprised that I went all the way to request it. I'm like, it's better we know what it
Yeah.
is, or it's better we check and it's nothing,
Yeah.
than for us to say it's nothing and
Yeah.
then it's something.
Yeah.
So we did do the scan, and luckily the scan came back, it was okay. And then she was, okay, she was more confident that, okay, it's most likely nothing, and then
Yeah.
happy to just watch and wait. You should be able to open up to somebody. It's difficult to find community
Hmm.
here. I won't even lie. I came to this country by myself.
Hmm.
It's easier for people who come with their family,
Families.
but you should be able to find one or two, like you join a church or the WhatsApp group if you're opportune to. But you should be able to open up to talk to someone and say, you know what, this is what I'm experiencing, or I'm experiencing that. I remember also, I think it was 2 years ago or
Hmm.
sometime last year, I met a Nigerian when I went to do, outside work somewhere, and it was a Nigerian lady. She came in, she had just had a child, and
Hmm.
she came in, she was like, I'm not sleeping. I wake up every night,
Oh.
my heart is beating fast. And then she had this very toxic workplace that she was at. And then she went, and she saw me, she just started crying and
Oh
talking and talking and
God.
talking. And then I said, I may not be able to solve all your problems, but what I'll first do is, and then she was having headaches as well. And then I checked her blood pressure. It was very high. And
Jesus.
I'm like, this is why you're having headaches. And, that's what she was so happy. She was like, can I be your
Yeah.
friend? Can I take your number? I'm like, I'm not really, it's doctor patient
Patient
relationship. I'm not
relationship.
supposed to, do that, but I'm here a lot of times, and you can always book clinics. And, we sorted out her out, but
Hmm.
she was happy because she saw someone that she could
Looks
relate
like
to,
her. Yeah.
looks like her, she could talk to.
Hmm.
I'm not saying that you should always look for someone that looks like you. No,
Hmm.
it's easier when you find someone that looks like you. But the truth is that the
S-
fact that you find someone
Some
that looks
people
like you
and they
does
ignore
not mean
them
that they're going to
to
be
treat you
nice to
well.
you, or does not mean that they're going to
Yeah.
treat you well. But I'm
Yeah.
just saying you should be able to have enough confidence in the person who you are entrusting
Hmm. Sure.
your health or your life to,
Hmm.
and be able to speak to them and open up and be honest about your symptoms, and be honest about things, about the help that you're seeking,
Hmm.
because we can't really read minds, you see. So you should be able to be honest enough to say, this is how I'm feeling, or this is what's going on, and I would like help. And a lot of these things, most of these things are not, don't involve money.
Hmm.
They're free at the
Hmm.
point of service.
Yeah.
You should be able to open up and access, because what you don't know
Hmm.
will kill you. It will kill you and kill you so fast,
Hmm.
and you'll leave your family
Hmm.
in problems.
Hmm. Hmm. Thank you so much, Dr. Zelda, for taking out time. You know, we all have time in this country, the opposite way. I'm so grateful you decided, for the love that you have for people. You decided to come in. You were even the one chasing me, because time for me, like, oh, this, I want to do that. But you came in, even before the start. I was still busy trying to sort out the kids, prepare
It's
food.
okay.
I'm so grateful. Not just me, we are grateful, as a community. Thanks for all that you've done. Thanks for all that you're doing. Thanks for pouring out your life into people. Thank you for being yourself. I'm so grateful. Thank you so much.
Thank you.
And this, I believe, we'll tell people. I don't tell people to share, but please, if you're watching this, send it to as many people as
Yes.
possible. Not because we want followers, no, that's not it. It's beyond that.
Yeah.
And that's why I don't even put subscribe. I don't,
Yeah.
is at people's will if they
Yeah.
want to. I know there was a time I put it on the WhatsApp group, and that was because someone said, "Oh, share your YouTubes are educative." I just do that.
Yeah. Yeah.
But so I just felt, okay, particular day I did that, and I don't do that. But because life is very precious, life is precious as
Mhm.
individual and as a community of
Yeah.
migrants, irrespective of where you are from,
Yes.
whether you're from Zimbabwe, Kenya, Uganda, South Africa, Nigeria, anywhere part of the world, we are all humans, even for people who are not migrants.
Yes.
Please send it out to them. The purpose is so that we can preserve lives.
Yeah.
Every man has destiny or purpose to fulfill. And if that purpose is cut short because of our health, and if you even look at it, I was looking at the likes of James Young Simpson. He was the man that founded this chloroform
Mm.
that one of the queens, had to use as an anesthetic,
Mm.
labor pain to
Yeah.
help reduce labor pain. He died young. Even
Mm.
here in this climate, people died young many years ago.
Yeah.
Some of them, they had cardiac failures or what we call heart failures. Some of them died in their 50s, in their 40s, and they did so many things within that short period. But as medicine advanced, and it's part of everything we've said, that it's part of God's witty invention, God's wisdom,
Yeah.
God's gift to mankind. Go and till the ground.
Mhm.
There is gold. If you don't till that gold, you won't get anything.
Yes.
And then lives changed. And nowadays, I don't want to still really go, but no, no, no. We need to go into that. Nowadays, for people who are struggling with their weight, who are struggling, there's so many
Yes.
options. They can refer you to weight management. They can teach you how to eat,
Yes.
what not to eat.
Dietitians. Yeah.
Dietitians, they can teach you so many things. And with that, you say that even people with high blood pressure is like
Yeah. Wait. Wait. Wait.
weight.
Yeah.
There's so many issues with weight gains,
Mm.
and everything. So please seek help. And that's the
Yeah.
summary. Even if, for instance, the last is that if you are living in the United Kingdom, without papers, you understand, you can still access health,
Yeah.
except if
You
the home office has written to you that you cannot.
specifically.
I have a friend, there was a time they said you cannot access
But you
health
can also, even with that, you can access an
online.
emergency.
Oh, yes, you can,
And
because
then
life
there are
is precious.
online
Online,
private GPs
yes,
as well that you can pay a little bit of money for. But
yes.
yeah.
But one thing you don't want to do is this. A story. I heard this story many years ago. I think almost 10 years ago when I came to this country. Someone said, if a friend did not have papers, you understand when we say papers, and then she now collected her friend's NHS number and she walked into the hospital to seek for help. She did not return back. She died.
Oh wow.
So according to the system,
That person is
that
dead.
person, that NHS, the owner of the number, original, is dead.
Oh wow.
So such that once they put in everything, that person is dead.
Hmm.
Everything deceased. But whereas that is not so, we would not encourage
No.
falsifications of
No. Absolutely
identity,
not.
and don't be afraid that they might deport you from there. These are some of the things we need to talk about when we talk about migrants' health.
Hmm.
Migrant health, maybe when it comes to no paper issues, is filled with anxieties,
Yeah.
fears, even such that when you see police cars, coming towards you, think they are out there for
Hmm.
you. We understand your pains. We understand your pains, but please still seek help.
There you
We
go. That's
love
why you
you.
need to seek community.
Yeah.
And your community can always sort of guide you as to the best way forward, really. Yeah, and everything is within your reach. Just ask. Yeah,
Thank you.
Thank you. Thank you for having me.
Thank you, Dr. Zad.
It's been really good
It's
talking about
been great.
all of this, and I hope that people listen and people, just not listening but also doing is. Some people can listen but don't listen actively,
Yeah.
and some people hear but they don't do. And that's why the Bible says you need to be hearers and doers. So just don't be hearers.
Mm.
I'm just going to summarize and say, when you come to the UK or you are in the UK, please register with your GP, and then you get that first appointment and go from there. And if you notice anything that's not normal for you happening, please seek help. And the third thing is try to find a community, whether it's a church, just
Mosque,
anyway,
anything.
mosque, at work, but just find a community, find your tribe, people that you could talk to. And even if you don't have answers or you don't know how to seek help,
Yeah.
they can also direct you on how to seek help or
Seek
what to do.
And tribe does not mean your
No,
tribe.
yeah.
I'm a Yoruba person.
No.
Tribe. People you
Tribe
can
is your
relate,
community.
irrespective of who they are, whether they are white or your
Yeah.
tribe. People you can flow with.
Yes. People that you can trust, people
Yeah.
that you can find support, with.
Yeah.
You should, sort of find that for yourself. It's difficult, it's lonely, it's different, it takes time, it takes effort.
Yeah.
And effort is with the capital letter E. But at the end of the day, we'll all get there to a place
Yeah.
where we have happy and healthy lives. Thank you.
Thank you, everyone. Thank you so much. Thank you, Dr. Zell. Thank you for
Bye.
watching and for staying through. Bye. Thank you.